for you. But if you can, get you some water, get some coffee, some tea, and we're going to start right now. We're starting a little late, but that's okay. I want to welcome everyone to our Best Start Partnership meeting. And it's hard to believe that it has been since August, since our last meeting. We switched some things up just a tad. So we are meeting every other month, but this is our month, and we have a lot to cover today. But before we get started, at your table, you should see the QR code. Please scan it and get signed in. We want to make sure, and if you can't do it from the table, you can do it from here. We want to make sure we capture everyone's attendance. So please do that for us right now. Bienvenidos. Sign in, register. Yeah. Also, for your convenience, we want you to know we will be recording this session. So Mr. Owl in the center is capturing all your beautiful faces on this beautiful fall. And everybody enjoying the change of seasons. Fall has fallen and it is officially jacket. Yes, yes, thank goodness. I was tired of all that heat. We need a jacket. So we want to thank you for that. We do have agreements. If you don't want to be recorded, just, kind of read that and let us know. So our Best Start, we're going to be talking about where we are with our Best Start CCA. But so this is our Best Start vision. We're looking at building collaborations to support flourishing communities. This is our community. So we operate with compassion, respect, communication, integrity, and acceptance. So this is our platform for what we do and how we do what we do with Best Start. And you're a part of that. So this is our agenda for today. We're going to review what we went over in August. Again, it's hard to believe our last meeting was in August. We're building together, talking about our efforts, what we have been doing since the last time we met. We will also be presenting our CCA projects. We have a special presentation by Adam Seaton from All for Kids and talking about some policies that will affect our childhood education and things that affect children and families and what's on the desk of Gavin Newton right now. We have some committee updates and we have some Best Start learning opportunities and announcements. So what we hope you walk away with today, this is our goal. We want you to walk away with, first of all, smile at somebody sitting next to you. Don't be looking at you second over second. Smile. Say hello. Make sure you wear a name tag and introduce yourself. Speak a prayer. Then we want to make sure you understand the process or the progress of each of our community change projects. We are looking for committee members. Join the committee. Get involved. This is an initiative community-led. So join the committee and then learn about All for Kids policy agendas and what legislative bills have made it to Gavin's desk. That's what we want you to walk away with. So here are our meeting agreements. I'm going to ask for a volunteer to come up and someone who doesn't mind coming up and reading the meeting. Oh, we can hand you the mic. Who? Just raise your hand. Okay, that was gonna say somebody ready, or you gonna get voluntold.
Okay, so we'd like to be punctual, stay present and engaged and on topic. Put the focus on the future, be authentically yourself. One person speaks at a time. Agree to disagree respectfully. Finish your sentence, not your paragraph. Step up and step back. Exercise confidentiality when necessary. Be patient and open to technology. Assume positive intentions. A rainy day will make flowers. Oh. Yeah. Separate a person from the role. Be creative and have fun.
That part. Thank you so much. That part. Have fun. We're going to use our creativity, but we want to have fun. as a community, we are going to spark some ideas. So I'm gonna have David come up and he's just briefly review our partnership meeting from August.
Morning, thank you.
Good morning.
It's been a while since we had a regional meeting. So, it was in August and August feels like it was forever. It's like literally a completely different like climate zone since then. But so, what we went over last time was, going over our projects and the updates that have been completed by then. So the point of today's meeting is that we're going to be circling back again. And a lot of these projects have already reached completion, in which they're undergoing, they're, real. But last time we were talking about how our community engagement piece was going, how that work group was set up and how it was set up to, set up childcare educators, according to our community change agenda. It set up our data updates. We had a lot of updates for review that our data committee was undergoing in creating our childcare needs assessment. And on top of that, what our resource mapping guide looked like at the time. On top of that, we also had updates from our policy committee and policy projects, alongside what our sustainability looks like too. So that's what we went over in our last one. Today, you guys are going to be seeing, more finalized updates from that and how it's been since then. So from there, yeah.
Thank you, David. So before we get to our CCA projects, we've been building together. First of all, I want to commend all of you. We have been busy as a community, and I want to show you some of our effort, what we've been up to, what you've been up to. Thank you so much. Our play group, yes, yes, yes. I'm going to have Cassandra come up because I want her to expound. I am so happy to have her as a part of our team, and she is a community leader and being operating as our facilitator for our play group. So turn this over to her.
Thank you. Hi, my name is Cassandra. I started this cohort this fall season. So it's collaborating with our community, letting them know what is Best Start, right? So understanding what is Best Start it was created by First LA, which supports children from 0 to 5 and their families. So having them amplify their voice is what this play group is all about. It's letting them know that they can advocate for themselves, for their community, for their families. And then how do we do that? So how do we get the community to come and join us to make sure that our voices are being heard together, right? And how do we use our policies? How do we do that system change with them? So giving them the information for them to know that it's not just from 0 to 5, but we can keep it going for our future and for our next generation, right? So it's just making sure that not just us, we stop here, is continuing that legacy for us to grow to be better. So it's just providing the tools for them. And as well, the little ones enjoy the playground while mommy and dad are in the class, learning how to advocate for the family. So thank you.
And she's been doing such an awesome job. We meet once a month at Play Amazing, and it has been amazing. And she's done a wonderful job in facilitating. I'm like, girl, you are moving on. So expect more from Miss Cassandra. Also, we have our Offer Kids food distribution that we have been participating in. In fact, we just had it yesterday, where it is a distribution of produce. So Offer Kids is a part of that, and Best Start participates by helping distribute the needed produce to our families throughout the community of the Antelope Valley. And it is free. It's for all the communities. So flyers, I believe flyers for that, but you will know we have it every month. Okay. Then SLEA therapies. I'm going to turn this to Stephanie.
Hi, everyone. Hi, Kelly. I just want to say Kelly because she's my SLEA therapies. Another thing we've been doing for these past couple of months is we had a Train the Trainer series. And in this photo, you can see in the bottom right here, you see 4 of our amazing facilitators now. What the topic was called was building bridges to multi-service coordination for stronger communities. So what these now trainers learned was how to advocate for their child in different workshops that they were going through. One, community and child development, disabilities and inclusion, learning different environments and how to make those spaces inclusive, advocacy and academics, cultural and equity and diversity. So again, this was hosted by us with collaboration with SLEA Therapies, who was the one who facilitated these workshops for these amazing new trainers in this area of advocacy within early childhood development. And I know I see a couple of people here that are trainers that did this, series. Just want to ask if you guys want to say anything. Possibly, I'm looking at two people right now. If not, it's totally okay. I just want to see if you guys wanted to mention anything. Yeah, I'll hand you the microphone.
Hello, everyone. My name is Anthony Hicks. I'm very happy to take advantage of these opportunities to learn new skills as relation to child development and how to advocate for parents that have children with disabilities or anything learning. But I met a lady yesterday. That's what I wanted to share. And she have a son on the spectrum with serious behavior issues. And we was talking in Home Depot. And I heard her talking to a person about it, and I interjected in the conversation, being friendly, but the point is, I was offering their services here. I directed them to them, to SLEA, to help with their son issues, because they didn't know what else to do. They was sounding so frustrated about their son and his behaviors, and they don't know what to do. And I said, there's people out there that understand and they can help, So I just wanted to share that there's a lot of people out here that's just still struggling with children that they don't understand. So they need advocates and they need people to help direct them to resources and let them know that they're not alone, that there is support.
Thank you. Oh, and then Cynthia is one of our others trainer.
Hi, everyone. I'm Cynthia Sanchez. So I just wanted to add about the SLEA Train the Trainers, the multi-service coordination. We met every Tuesday for 6 weeks, or was it 5? It was 4. 4? Or 5? 5. Okay, I was like, I knew it was more than 4. For 5 weeks. And it was amazing because SLEA brought in the professionals of that area. So we had like an occupational therapist, we had an BCBA come in, we had Callie step in as a child development background. So it was awesome to be able to have so many professionals come and train us and be able to ask those questions that maybe we don't have the opportunity to ask when our children receive, my child received early start services. So, but I wasn't able to ask, and then I was learning a lot of the background and how they support with like occupational therapy and what developmental area does that support. And I thought it was just amazing. I wish more people would have signed up, and I hope they do it again, because honestly, it was great. It was great information. It really, it was really awesome being able to, like I said, ask the professional and be able to get that information, that training from the professional that helps in that area, and then being able to advocate in the school systems. And they also went over through all of that, why inclusion was important. And I think it's important for all of us to at least be able to support our children, and not just our children, but other moms that need that support with the school districts that might not be giving the school, might not be helping the children in all the areas. So now me, Anthony, and Tess kind of know a little bit more, and we can guide parents with that support. And even with the Green Regional Center system also, they went over that and how to support and how to advocate. So thank you so much, because it honestly was such an awesome training, and I hope you have it again.
Thank you. We hope you co-host it now. You, Anthony, Ted, together as trainers. And Bethel. Oh my God, Bethel.
Yes.
All right. Thank you guys again for sharing now. Bethel, is there anything you would like to add, before I move on?
Yeah, sure, okay. Okay, so, the AV community and the regional center, that training was amazing. These people were highly skilled, and encouraging us, you know, I felt like it was a mindset change and really helping us understand how to focus, the language that we teach our children, not just spoken, but the language of communication, the training, the education. I know there were some focuses on that and how to be successful in the educational realm. And the involvement was especially important, you know, to see the success of our children's development. We don't want our children or ourselves to go down, but we want us to progress. And at the same time we progress, our hearts grow. Yeah, to become more successful. Have a nice day.
Thank you, Beth. We can move on to the next slide. So our Hispanic Heritage Month celebration. So earlier this month, October 1st, we had the Hispanic Heritage Month celebration with collaboration with DMH, Department of Mental Health, and also the Regional Center. So this was an amazing event. We had, I want to say, over 12 vendors there and over 70 participants at this event. I think it was amazing. It was beautiful, learning from different speakers. We had a Latinx therapist as well as Helen from, oh my God, I'm blanking out. Habitat LA presented as well. I want to say the Regional Center, again, did an amazing presentation on advocacy 101 for parents, how to advocate for their child. And also just the basic of what is advocacy, you know? We know that sometimes people get very nervous or like kind of like, politics, advocacy, no, I don't want to learn about it. I'm not capable of it. But no, their presentation was literally letting everybody know that you are an advocate. You just don't know it yet, but you are an advocate. And this is how we're going to explain to you how you're an advocate. So it was the basic 101 introduction to advocacy, which was amazing. Again, in this photo is, you know, the ladies from DMH, the Regional Center, myself, Sheila's not there. Oh, yes, they did present as well. The photo, but they did present as well. But, and yeah, I don't want to, Sandy, if you want to mention anything, I know I keep pointing to the audience, but it's because, you know, all these events are a collaboration. It's the community. It's not just Best Start hosting them and that's, you know, we're the ones doing all the work. No, it's really collaboration, not only with other agencies, but also with the community. So that's why I'm like, if you want to share, please feel free, you know, I can hand you the mic.
Share the challenges. There's no challenges, everything else. We with Regional Center, we love collaborating with other community partners. We want to bring the community partners together because we all service the same community, the Anglo Valley. We are here to make our community better. We want our community to thrive. So anything that we can do to put a little grain of salt into that pile, then we want to do that. The Hispanic Heritage Celebration, it was beautiful. I want to thank anybody, I'm not sure if here attended, but we had some great presentations that just, you know, expand our knowledge. And that's what we're here to do. We want to share the knowledge. We want to bring community partners together to make and teach our community. Advocacy is so important. I think, and I'm so happy that Best Start is targeting that because we do want to encourage parents to advocate for their children, families to advocate for their communities. So, yeah, anybody here, please, we're going to have an advocacy workshop coming up. So invite everybody. We want those rooms to be filled so that, of course, we educate more of the community. But partnerships, we are here and ready to partner with anybody that wants to partner with us. I just wanted to add, so TMH had hosted this event last year, a heritage, Hispanic Heritage Month. This all came from Salt One Funds, which is also a community that is with agencies. It's a community of just community members. all the mental health agencies that come together, and the community says what target areas they want, what type of events do they want, what does the community need. So this is one area that they had mentioned that they wanted to have a Hispanic heritage, and last year DMH had it by themselves, no collaboration, only 20 people came, around 20 people. So this is the power of collaboration. I just want to say this time it was Bestar, it was Chila, it was Regional Center, it was DMH, and we were able to have 70 people. We wish we could have had more. We had, I think, over 130 registered, and not everyone showed up, but we did create more change. We created 70 people compared to last year when it's just one agency. So the power of collaboration shows in this event, and I just want to say, like, anytime any agency here with Bestar with us want to collaborate, if there's a community, even as a community member, as a parent, is there a need that you see for your community? Please reach out to one of these agencies, because we all have other focus areas that we want to focus for our agencies, but we also have our passion projects and we all want to collaborate. And Bestar is an amazing partner and Offer Kids. They give us a space and we're able to collaborate and target different areas that our community needs. So I just wanted to highlight that, because I think when we all come together in this space, it's important to really highlight the power of partnership and collaboration. So thank you.
Thank you, ladies. And now I'm gonna pass it over to Lizette, because our outreach specialist she's been working, and we wanna highlight her work and all the dedication she's been doing on these resource events.
Thank you. Good morning to you all. Just wanted to share that we are out there. We're trying to share these services, these workshops, these trainings that our community is in need of, and just letting them know, hey, these are in your reach. We went to APH, went to 36 community events, and the Bestar flyer, the calendar, the workshops have all been shared in these events, all the way from Lake LA, Lancaster, Palmdale, Little Rock, schools, after like back to school nights, high schools, middle schools. We're all over the place. 16 of those events I actually participated in, parts, connecting with the community. We have flyers displayed in different lobbies like Rick, Wesley, Bards, and the Women and Infant Pavilion. We have, I'm getting a little bit more used to the presentations, but here I am on stage. I've also did a presentation with the WIC AV admin, and being able to show them what else they can share with the clients that they're working with is always a satisfying to see that they're able to bring something back to them. So yeah, these are what's been going on since the last partnership.
They've been busy. Thank you so much, Lizette. Who's going? Thank you, Gloria. Yeah, so we're gonna move on now with our community change agenda projects, things that you have been doing. I'm gonna turn this over to Gloria because she is going to present the first one, which is Launched, Up and Going.
Good morning, all. Once again, my name is Gloria Vargas, and as Mr. L mentioned, we have our first project up and running already. To our staffs, to the trainers. Just to share with you, I will bring up Miss Cynthia again, because she is also part of our project, and Miss Sandy, to share a little bit of what we rolled out since the last time we met, and what we started already since the last time. I think Ms. Kaya shared with us yesterday. It was like if it was yesterday, because we're talking about what happened, and now we're actually here sitting down in the training. So that's how much all staff and community have put so much effort within these projects. So I'll go ahead and have Ms. Cynthia talk about what we rolled out, what we've done with our project, and what's coming up. So,
Don't leave me alone.
and while they're doing that, I will be passing out the actual curriculum of our project and certain things we've accomplished.
Hi, everyone. Sorry for seeing me again. But we are trying to partner and just do as much as we can. But what have we done? We completed the curriculum training. Yesterday was our first one with our educators, and Ms. Kaya is one of them. So we have one of our educators here. So we're really excited she was able to join us, and we were able to have 5 educators, but we are expanding to 8. So we are gonna have our next training, we're gonna have 8 educators that are gonna be completing the curriculum. We completed the family child care checklist, and we now have the educators training dates and schedules. So, we're gonna be meeting the 22nd, the 29th, and the 30th are gonna be the next dates. So, now I'll pass it to Cassandra to share some of our challenges.
So some of our challenges was the project group schedule and the fallouts of the members. The DEI workshop will be our next one, our following Wednesday. So what success we're looking for is all projects. Group members will facilitate and educate their education training, right? So educating not just an outreach, but educating the community, letting them know how to get childcare, what's the budget, what it is, how to enroll, what are you looking for enrollments. So it's just informing them how to get that childcare that they ideally want for their children. And then
Hi, so and some of the strategies that we're using is we want to connect with our educators. So we're so thankful that there's interest there of community members that want to be in part of this program. And like I said, this started as an idea here and it flourished into an actual program. So we were very excited about it. We want to graduate the 8 educators that are participating in it. So we are connecting with them, making sure that they are able to participate in every single workshop and successfully graduate, and that they are out in the community sharing all the information about childcare, access to childcare, which is what we want. We are planning to finish all the workshops in October so that we can go ahead and move this along. We want to see this completely flourish within this fiscal year. And what are the next steps? Well, the next steps is finish the curriculum. We are going to be reviewing the checklist, either passing along the checklist that our group came up with, as well as the actual workbook that our educators or childcare educators will be carrying with them as they engage with members. So we are very proud of this project. I am so happy. We know that this is a childcare desert. So, and this is what this meeting is so important. Come to this meeting. Let us know what is something you want to see change in your community, and we can work to make it happen.
Thank you.
Thank you. Yeah, I think we covered it all. We're ready. I want to highlight this.
Yes, you will definitely be able to access the curriculum, the checklist, the Best Start AB checklist at our childcare resource hub. So that is another project that we're launching that we'll talk about in a little bit in a couple of slides. Another thing I wanted to highlight is that these trainings are 4 sessions, 2 hours each. So like you said, not only are the facilitators putting in work, but also the new childcare educators in the community. So I also want to, say kudos to them. And again, Kaya is one of them that is signed up and is going to be a childcare educator. And what they're going to do with this information is go out to these areas that we know that it's not easy for them to just travel down to CCRC all the way over here in West Palmdale, so we want to get them prepared as like, hey, this is how enrollment is, how the process is to, get your child into childcare. These are some prices that we've seen in the AB, you may be eligible for a subsidized program. So I just want to highlight that. And the curriculum and the checklist was all developed by the project group. So the work group was the one who really developed all of it. So if we could give applause to them as well. They've been working since June, so it's been in progress.
Yes,
So the last meeting I did mention that we don't want this to be created and just housed here and it stays here. This is meant for the community. So for those who worked in the work group and created this,
make sure you reach out to them, connect with them. If this is something that you'd like to see come to your organization, or you want to host something like this with parents, we now have facilitators who have created this and can deliver this. We will have educators who will be able to inform. But the reason I want to highlight the work of the facilitators is, again, this is supposed to be accessible. This is not supposed to just stay within these four walls and like, oh, great job, we did it, and that's it, right? So please make sure that you connect with our facilitators. This is the whole purpose of having the network, right? That you guys get to know each other. You know, like Cynthia worked on it, Cassandra worked on it. You're like, hey, I really want to bring this to my organization. They don't need permission from all four kids or like from us to say, hey, can we do this? They can absolutely do it. The curriculum belongs to the community. I really want to share that.
That's awesome. It's been a lot of work. So next, okay, pilot programs and capacity building. This project we've been working on. So I'm gonna ask my members that are here, Ms. Day, Denise, come on up too, because some of our members that have been working on this particular project are actually at work because they are child care providers. And so they couldn't get away from their kids, but we have an extension. This is the business portion of it. So I'm gonna turn this over to Ms. Day.
Good morning to you all. So I want you to know my arm is twisted. I should be at work too. I don't have any kids, but I have a job. So, so this has actually been an interesting role because of the fact that Jarrell had started out with a criteria, and she sent it to me. And those that know me know I'm the big mouth in the room. And so I sent it back with all these notes that says, hey, listen, where's the foundation? So we actually went back because these childcare providers need to understand that it's a business. And yes, the business is children, but it's first a business. And you need to know what that business is. So we broke it down to module 1 is the introduction to just the overall childcare business. Then module 2, we get into what kind of childcare business are you wanting to go into? Because a lot of us think that, oh, I have to start out as a home daycare. That's not true. You do not have to start out as a home daycare. You can take that big leap and decide you want to be a center. Nothing stops you from doing that, right? But we don't know that. So that's really where we break it down to show you the differences in these different types of, I'm going to say organizations, because that's what they are. So the organizations that reference the childcare businesses and the type, your type will also give you the criteria of how many children that you can have per person. How many assistants or aides do you need? What kind of licensing do they need? And that gets us into module 3, which we get down to what kind of licensing do we need? What does the center need to have? If it is at a home, what does it need to have? Your health and safety rules and regulations. So it sounds really like in depth, and it is, and it should be, because in the past, we've only covered the surface. They get your license, the state gets your license, and then they want to come back 3 years later and slap you on the hand. Well, you didn't tell me I needed to do that. So we're going to tell you what you need to do, right? So some of our challenges has been meeting times, right? So I'm going to tell you that strategies we're going to implement has been Doodle. Doodle is your friend, y'all, when you got to like try to figure out what days, times work. Doodle is awesome. Zoom has become necessary. And so, you know, we have to make the time, because this is super important for us to get off the ground. I would say by next meeting, we should be ready to at least roll out the first half. Yeah. Okay. And what are our next steps? Our next steps are dealing with modules, finish module 3 and deal with 4 through 6, so that by next meeting, we can tell you, hey, listen, we're ready to teach your educators and as well as other daycare business, whether they be current owners or they are aspiring to be an owner, we're ready to take them to their next level of how to operate legally, in policy, functional business.
So, okay, so that's our table of contents, what we're working on. Again, module 2, we're talking about licensing, health and safety requirements, budgeting. Module 3 is budgeting and business finances, all the fun stuff that we don't like to talk about. But if you want to stay in business, we don't want you to start a business. We want you to stay in business. So we're going to connect with that. These are the things that we are working on currently. And record keeping and business taxes. I did say that bad word, dirty word, taxes. So that's what our team is currently working on. Next we have coming up is our data-driven analysis. Turn this over to David.
Denise, I forgot to mention to you, you should probably stay up here. But we also have Laura coming in, who's gonna talk to us about this too.
Somebody else needs to talk this one.
Oh, yeah.
It's your turn, Derek. I don't
Hi, my name is Laura. I'm a volunteer on the data committee. I thought I was, forgive me. I'm on the data committee with David, Cruz, and Denise. So what we've been doing is we've been trying to gather as much of a data from all of the participants, caregivers, even people who have internal services providers, organizations, what have you, to participate in surveys. Why do we need to have surveys? Because we need data to get grants, basically. We need to know what the needs are. If they're in the public, your organizations, what the kids need. Yeah, so whether it's disabled or, you know, if they have specialization, certifications, licensing, there's all these kinds of, you know, this is fabulous what they've developed. So I'm super encouraged by everything for today, frankly. So anyway, what we're asking is that we're going to be rolling out a survey coming up here in the next couple of weeks. We ask that you please pay attention to your email. Please answer the survey, but don't just answer it. Please send it to at least 3 people and ask them to send it to at least 3 people. And that's the only way we're going to really make a difference and really understand what the community needs at this point. Right? So anyway, I think that's fair. Thank you.
Yes.
And send it out to 3 people, but one of the biggest issues we run into is getting the people at the table that need to be there. So if you know people that need to be a part of this, that need to be a part of this survey, that have children, grandchildren, that are caregivers, make sure you send it out to them, because we need to get the people that are in the trenches, not just those of us sitting in this room, which is what usually happens. We all do the survey, but we need to get it out to the people in the trenches. Okay, so send it out to maybe those people that you think, well, maybe not. Send it out to them anyway. Send it out to half a dozen people, and at least 3 of us fine. So, yeah.
Thank you. Guys. I'll try to give you, but yes.
The survey is targeting childcare providers.
Yes, I'll verify that. Yes. So again, Laura, Denise, thank you guys for being a part of this. Laura and Denise have been a very consistently part of our data committee meetings. And so they've seen the development of this childcare provider needs assessment. To give you guys a little bit of context on this, if you scan that QR code right there, you will access our childcare provider needs assessment. Right there is a kind of a screenshot of the first page. So what you're going to see there when you scan it is you're going to see a bunch of questions that are very relevant to childcare providers. And so, as I mentioned, our regional meeting last time, we've been working on this. We were working on finalizing it, and now it's live. So this is ready for anybody to, you know, who knows a childcare provider, anybody who knows a childcare provider who wants to share their experiences, who wants to become an advocate, who wants to be a part of, you know, a data collection piece that speaks to all the advocacy and pilot programs that Best Start is conducting. You know, it's right here for them. So that's something that hasn't been done yet in the Antelope Valley. It's actually very hard to find context on asking childcare providers themselves questions about their experiences, about their logistics, and where they need support. You know, as opposed to, you know, a lot of studies asking the parents directly. So this kind of flips the table a little bit in what you're actually asking the providers themselves how we can support them. And furthermore, this data actually serves you know, to help continue support the information that our childcare educators receive and guide the work that our pilot or the rest of our pilot programs are you know, conducting. So just to give you guys a little bit more context, we've been working on this also for a while, right? And I think the timeline here is that I mentioned it's like July that we started working on the questions, July, August, September. We've worked on getting all those questions done. We've worked it through providers to give us their feedback. You know, we talked to representatives from CCRC, Child Care Resource Center, to give us a little bit more talking points as well, to give us a little bit more context, because, you know, we don't know everything. We'd like to get as much experience to be leveraged into our data and transparency. So this survey is live, right? So this, as Denise and Laura mentioned, please, if you know a provider, share it with them. We're trying to get this out, and we have an outreach plan that sets on mailing. We have a bunch of addresses that we want to reach to, so that's going to be something physical and that's going to be accessible. We're going to have phone and text for anybody who you know, is within our mailing as well, e-blast, and word of mouth, which would be our residents who get in there, because, you know, we don't know everything, we don't know everybody. So, you know, that's where we ask the community to take their part in being able to share this for anybody who they feel would benefit from, you know, being a part of the success. There's incentives too. Also, it's, if you look through it, you're gonna see it's a bit long, but that's the point. You know, nobody's asked this question to our providers yet, and nobody has, you know, actually bothered to take into account that they are pillars of the community. It's a very, if you continue to, you know, ask provider after provider, it's a very, 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 very underappreciated profession,
Yeah.
especially within the Antelope Valley.
Yeah.
But yeah, if I move into the next slide, we, you know, since this is live and since we have an outreach plan in place, our next data committee update is going to be in attending on the 28th, where we look over all the data that's been collected from this point now to then, right? This survey or this needs assessment is going to be live until December. So we're going to have time to collect responses, to look at data and create insights as we collect it. So that's something that I'm very, very excited for. So if you guys want to see any more updates on this, if you guys want to provide feedback, if you guys want to see update, like the insights and responses that our childcare providers are answering this anonymously, you know, if you want to see that data, feel free to join in. We'd love to get more feedback. And as you know, I think Denise mentioned, we'd love to get more experiences to help us continue to guide this work. So I'm excited to say that, you know, this is another project that's gone live, and you know, we're going to collect a lot of insights here from our childcare providers that ultimately will help the rest of the community. So yeah, thank you guys.
Thank you, David. All right, I'm going to ask Stephanie to come.
And then I'm gonna ask my wonderful policy committee up here. You guys heard them talk already, but they're busy. And then this image is, a couple of PowerPoints that they have already developed and they're going to be teaching just from the last update. Last time, remember we were saying that we'll do an advocacy workshop for parents that really target multilingual, DEI, special needs, anti-bias, anti-racist, and then the advocacy 101. So I'm gonna hand it over to Cynthia first.
Hi, good morning. So what have been the achievements so far? So the achievements so far have been developing and finalizing the presentations. They're now done and ready to roll out. We actually had, like Stephanie mentioned, for the Hispanic heritage, since we had the Advocacy 101 and the event was focused on advocacy, we thought this was perfect opportunity for us to kind of share this with the community and get feedback, and it was great. They loved it. They loved the presentation. Also, Regional Center, I'm not sure if everyone is aware, had systems were created because of advocacy that came from parents. That's the reason why California has Regional Center. So what perfect way for us, what perfect community project to join, change project than us Regional Center to join this project. That's how our systems were created, was through advocacy. So we made sure to share that on the Advocacy 101. So we're really excited. We're gonna be rolling this out hopefully soon, November, yes. Sorry, I'm mixing up all of them. By November, so, and then we officially have the dates and the times. And so we're really excited to be rolling this out for our community.
So some of the challenges that we have faced with creating the advocacy workshops and the material is, of course, we all have our duties and jobs, day-to-day jobs, such as working within our schedules to get together and create the material. We managed to do so, but now the challenges that are coming up is trying to come up with a date and time that works for the community that's able to come and participate in the workshops. So we do have the dates. They are going to be in November. November 7, 11, 14, 20, and 21, the flyers will be coming out with the QR codes so our community members can register to attend. They are going to be 1 hour long, 10 to 11 in English, 11 to 12 in Spanish. So, and they are going to be in person. We are going to target these various topics so that we help our families advocate for their family. So, but regardless of the challenges that we have encountered with our schedules, we are hoping to have a good turnout. So please, if you have any community members that want to join us for the workshops, share the information, or you yourself, and everybody's welcome to attend.
And the flyers are already posted on the Best Start Instagram, so please feel free to share it in your stories with your agencies if they can share it out to spread the word and hopefully get a good turnout for these workshops.
Okay, so I'm excited about these coming out because I really think it's important that we advocate for our children, and sometimes parents don't quite understand, like somebody said earlier, that we actually do advocate for our children every single day when we're fighting for them. So some of the strategies that we've developed as working as a team is understanding the community we're targeting. Not, we also spoke about the fact that yes, as parents, but we also want to get the dads involved if possible, not just the moms, because it's the whole family. And then knowing where to take the flyers, distributing the flyers to different locations. So one of the things that we've done is we've actually went to where the parents are, taken them out to some of the childcare facilities, to the daycare facilities, so that way the parents are getting them, because we found that oftentimes if we do take it to those facilities, they are willing to go ahead and give it out to the parents if they see that it's a good cause. So that's one of the ways that we've been getting the flyers out and trying to reach as many in the communities we possibly can, and not just the intimate, like the local community, Lancaster, Palmdale, but we want to also reach the outlying areas as well, so that we get the whole Antelope Valley involved and advocating for our area, so that we don't get left out when it comes to the finances and the policies.
So what are our next steps? Our next steps are going to be to facilitating the workshops that we mentioned in November. We're going to finalize our presenter notes, of course, go over that, trying to make it as simple language as possible, because sometimes when you talk about advocacy and policy for just a lot of our community members, they get overwhelmed, right? And all the jargon that comes with that. So we're trying to make it as simple and as plain language as possible. And working with the regional center, I have really learned to really try to do as plain language as possible, because it is kind of hard for our consumers to understand certain, and we want everyone to be included, right? And all of this is about being inclusive, about inclusivity. So sorry. So we want to make sure to be as inclusive as possible and make it open to all to learn about advocacy. And we're also going to be introducing the policy reform development. So thank you, Stephanie. And also thank you to Stephanie, because a lot of our meetings, when we can't make it, she's willing to go on team. She's willing to do it hybrid, and that takes work. But she always makes sure that we're all included as much as we can be, even if our schedule, she's willing to meet with us at any time, any day, and talk about whatever questions or updates that we have. So thank you so much.
Thank you so much.
And like they mentioned, we're basically ready to roll out this workshop in November. We do have, I did share with you guys an interest form the last regional meeting. I know it was a while ago. Well, now we have an updated one, the official flyer that has the dates, the time, the location, which is the locations here. Also, full incentive. So if you know a parent, you want to share it, they'll receive a $25 gift card. So for each session they attend. So I know right here you're only seeing four kind of intro, the first slide for each session. But there's one missing and we're still developing that. It's the DEI one. Again, another thing that people are very scared of, DEI, like, no, like, I don't want to be a DEI expert. Like, I'm not qualified. But it's not saying that you're going to be a DEI expert. It's really just bringing that awareness of diversity, equity, inclusion, and why it's important to have that knowledge, So again, thank you to the work group. We are missing one, Kari. Unfortunately, she wasn't able to be here today. I'd like to go to the next slide. Thank you. So I know a lot of it's already developed, but please, if you're interested, the space is still open for anybody who would like to attend. We would still love for you to, put your input, like Cynthia mentioned, like there's more coming. It's not just these workshops and that's it. So our next meeting will be Thursday, October 30th at 3 p.m. You to register using this QR code. Right here, you will scroll down, it will be like join a committee and then you'll put policy. If not, if you're like, no, technology is not my friend, never let the rail because she knows. You can also contact me right now. After this meeting, I'll be available. My email's right there as well. Again, I invite all of you guys to attend our policy committee. If you can't make it this day, please let me know you're still interested. I'll definitely send you reminders each month of when we don't have a set date and time for each meeting, just like, was mentioned earlier. Everyone's busy. So one date, one time each month kind of doesn't work for anybody. And we're doing like, hey, what day works for everybody bi-monthly. And it's been working out. And kind of like what was said earlier, if you can't make it in person, we would like to do hybrid. We just switched to in person like a month ago because now it's really the nitty gritty of this project. And it's really like, hey, here's a presentation, a physical copy. Let's work on the presenter notes. And again, like Carla mentioned, this is not just going to stay with Best Start. If you see a topic, if there's a topic that you're just like, I like that topic, and you attend that workshop and you're like, I want to, teach it to, a parent, or I want to teach it, bring it to my office, by all means, it's yours, like contact me. We'll give you that information. We'll give you the presentation, what the presenter notes. So you have all that information, in your head. And I believe, and the next one too. And then our last community change project, I know you're just, how many are there? But there's 5 going. And then this is one that we're very excited for. We have our first official childcare resource hub, which is again SLEA therapy. So what is this? So basically what they're going to have at SLEA Therapies is the resources and information of early childhood, of childcare. They'll host quarterly an info session that we hope that the educators could teach, their parents in their community and those who go into the SLEA Therapies offices about childcare enrollment, about the process, about the cost. So that is the goal. So it's not like we're teaching, so it combines together. It's like there's a system to this. In hopes that we don't just develop these childcare community educators and just be like, hey, thanks a lot, like you did it, It's like, no, like let's spread the word. Let's share these like resources that you just learned. They'll also be doing free professional development training classes for childcare providers. So this again will be quarterly. We do have our first session for childcare providers happening Tuesday, October 28th. Again, this will be at SLEA Therapy site. It will be 6:30 PM to 7:30 PM. We did it at evening time because we know providers are working with the kiddos, just like Darrell mentioned. They're busy right now. They can't, attend in the morning. So we did do it in the evening time. There will be food for the providers as well. What else? We did do a different marketing strategy this time around. We did postcards. So in hopes that they're mailing out, they mailed out actually yesterday. So providers should be getting this postcard in the mail with a QR code to be able to sign up. So if you know a provider, please feel free to share this with them in case they did not get that postcard in the mail. But again, thank you SLEA Therapies for being the resource hub. If your agency is willing or want to become a childcare resource hub, please reach out to me and we'll be happy to, do an MOU with Best Start and then your agency as well. So again, this is our last project that is rolling out this month. Oh my God. So 4 and 5 are rolling out, you guys, and it's all because of you guys. It's your work. And we want to say thank you to everybody who's been doing the work groups, everybody who's interested in attending these workshops, who are becoming the educators. A big thank you to all. And again, none of this is closed off. If you're interested in doing any of these projects, please feel free to reach out to any of the leads to now get involved and receive their updates. And then, yes.
Oh, and he just walked in the room. The whole atmosphere changed walking out. It shook. I have no presentation. So I want to introduce to you our Director of Policy for All for Kids. This is Adam Seiden, and he's going to share with you what's going on with All for Kids. Some exciting things about what's happening with policy, and especially things that pertain to our families 0 to 5. So I'm going to bring him up.
Hey everybody, good to see you. Stand over here so I don't have that blue. It was good. I was here last year, basically about the same time. Gave an update. I'm sorry I wasn't able to. I was on the schedule to come up here over the summer, kind of tell you about what our policy agenda was. I had some family stuff happen right before that, so I wasn't able to do that. But I'm really glad to be able to be here and kind of give you an update of where things are at, what kind of stuff we fought for, what happened, state and federal, and once my presentation comes up.
Give me 1 second.
Do you enjoy the rain yesterday?
I enjoyed it. Yeah, I love the weather. So I like put on an umbrella and go walking around. It was good. It was cold though. I had to like find it where it's going to sweat. Go down. What we're gonna get to is so All for Kids, one of the things we focus on is policy advocacy, is kind of talking to our local elected officials. We can't talk to everybody, but especially those where we're at. So we really are focused a lot up here in the Valley, we're also down in we have a Magnolia Place, which is kind of Pico Union near downtown, and also some in Orange County. And we talk with them about like, here's what we think is thank you. Go to the next. Here's what we think is really important for you to focus on, because there's so many things out there. In the news, you're just getting pulled in so many directions. And it seems like there's always some new thing. So like, oh my God, now there's this going on too. Thanks. But what we want to do is be able to kind of focus in all of these things, all these, couple thousand bills in the legislature. Here are the things we think are the most important. Here's what our agenda is. Here's what we think we can do, primarily to, prevent abuse and to nurture child well-being. Those are what we're pushing for. And so we have what we call our policy agenda. It's a slate of bills and budget positions that we do, and it kind of goes under these 5 categories. You'll notice some of the categories of the key things you hear about here, including like childcare. I know that's a big thing for us. We work with, I talk with Carla, policy person. We talk with Stephanie, just kind of make sure that we're all in alignment and hearing what things are important at that start. So we make sure we incorporate some of that into what All for Kids does, vice versa. And so these were the things that we kind of zeroed around. It helps us when we're, talking to the elected officials, because they have so many things. Like, here's the most important. Among the stuff that we were working on over the last number of months was our fight to try to protect Medi-Cal for kids. I say try to. We don't know how that ended up going. But it was really the important thing, because it was about $1 trillion of Medicaid ended up getting cut with the way the federal budget was passed. It was really not good. We were trying to avoid it. We were trying to, kind of talk to our people. We were doing it on social media, did what we could to at least let people know, that this was coming. As didn't go well. In addition to just kind of cutting stuff, one of the big ways they do it is kind of adding more red tape. So it's saying you have to prove that you are working, and you do it more often, and here are the more paperwork you have to do. You have to prove that you're eligible even to have Medicaid more and more often, which we just know when you add more red tape, more hoops to jump through, people will just fall off, not because they're not eligible, but just because it's hard to connect these programs. In addition to healthcare, a big thing was SNAP, CalFresh, with food assistance. That was another big thing that took a hit, and that we know will be affecting our families. So, looking at the state budget, it was I have a little better story to tell here. I mean, we did have a budget deficit that the state had to figure out. Regardless of what was going on at the federal level, we had our own state budget deficit, $12 billion. Some of that was solved by kind of dipping into our rainy day fund. Some of it was kind of internal borrowing, and some of it was program cut. There was some amount of just, you need to cut back on some of this stuff. And when you're in a deficit year, sometimes successes are seen by not necessarily starting new programs, but being able to say, well, okay, you were going to cut it this much. This is so important. Don't cut it quite so much. And there were some stuff that we had. It was kind of within the child welfare system. So a couple things like talking about, I think called the FERS crisis hotline, which is the thing. So if a foster parent or a youth within the foster care system is having an issue with their placement, is having some crisis that's going on, it's a hotline you can call to get immediate kind of counseling, trying to talk through things, trying to figure things out. We even have mobile response teams that will come out to your house to figure things out. This is often what is kind of helps, instead of having to call 911. Things happening. Let's get law enforcement involved. Let's see if we can kind of figure out this crisis, find a way to keep this family, this foster family together, keep that placement. And so that's a really important thing. And the other one was the Emergency Child Care Bridge Program. Again, childcare, we all know how important that is. If we want to get more people who are willing to be foster parents, they need to be able to find childcare. And so this program kind of helps support and navigation to help kind of go through all the different things you have to do to do that. So both of these were going to get about 45% cut. So, almost half, or about 45% cut in their budgets, because we spoke up. And it wasn't just All for Kids. We were part of a coalition across the state that were adding our voice to it. We were able to make that only be about 30%. May not sound like a lot, but going from almost half to less than a third, it's something. It's millions of dollars we're talking about for these really important programs. I'm sorry, go back one more thing. Just on the state budget. Keep in mind, this had to get passed by the end of June. And so the fiscal year, this was before the July 4th signing federal, Big Beautiful Bill Act. So all of that stuff that I was talking about in the last slide is now going to impact us. We're going to be seeing hits from that, trying to figure out exactly how much it is. There's a lot of kind of things we need to work out. But right now, the state of California is expecting about a $30 billion per year loss in healthcare alone. So that deficit I'm talking about, we're going to be down $30 billion in healthcare that we had been getting from the feds. So the next years are going to be quite interesting. So in addition to budget and talking about kind of money, new money being spent, there also is a legislative process. We have these bills that have to go. They start in the assembly, then they have to go in the other house and the Senate, and signed by the governor, and vice versa. Senate, it's going back to the assembly. So of our policy agenda, we were really happy that there were 4 bills that actually made it out of the legislature, made it onto the governor's desk for the governor to either sign or veto. And so the last number of weeks, we've been kind of putting a highlight on these things and asking the governor, please sign these. These are really important. 607 has to do, the top one has to do with a thing called home visiting programs, which is a kind of classic way of preventing child abuse, where you have new parents or expecting parents and matching them up with professionals to make sure that those first few months, couple of years of a child's life are so important. Let's make sure that they're healthy. Let's make sure that goes well. And this kind of like, it makes it so you can kind of go through the entire program that's supposed to be, instead of like an arbitrary cutoff day, like, oh, every 12 months you're done. But well, no, this is supposed to be until age 3. Let's let them keep doing. 753 has to do with childcare. We know one of the big reasons there's problems with childcare is because there's a shortage in the workforce. There aren't enough people who are able to or willing to work in the childcare field. And so this kind of makes it, kind of opens that up a little and say, okay, well, if you are in, if you are working, you want to work in childcare and you have done some amount of experience and you're working to get your degree, you're working to get that education, you have a plan to get that education, this would say, well, you could now work in some supervised roles, you can't just be alone with the kids all day, but like it's an extra hand in the classroom. And this allows you to kind of do that for a couple of years while you're getting that degree. 779 was authored by Assemblymember Tom Lackey, who represents this area. And this was a really good one that he did. It actually was trying to, it's trying to take a model that happened here in the Antelope Valley, happened with Valley Oasis, one of the nonprofit groups, maybe in this room, but I know it's kind of part of this coalition, and also the Pritzker Center, to match up when you are working, the people who are working in child welfare, having somebody they can talk to who is a domestic violence survivor, a professional who kind of knows the stuff, and because there's a lot of intricacies in there where things very special to people who are survivors of domestic violence that you kind of need to know, and special support you need to be able to get, and it's helping to make sure that works. So this is saying this program that worked really well in the Antelope Valley, let's let other child welfare agencies around California do that. And it's kind of authorized that other people can do this pilot program. And the last one, 898. Remember the FERS hotline I was talking about, where you can kind of call and say, hey, there's an issue, let's try and get some help before we have to split up. Well, this kind of asks the question, why do we have to wait until kids are already split? Why do we have to wait until they're already in the foster care system to go get them help? What if those who were kind of on the cusp of that, who they were known to child welfare, there was some issue, but the family's still together, let's let them use that hotline as well to, again, get that help, get that mobile response team. So maybe we can keep them together, keep families together. Let's kind of allow that to be moved upstream. And so these 4 bills, we've been saying, hey, Governor Newsom, please sign these so you can veto a lot of stuff. We're really happy, so the deadline for him to do that was past Monday. And so now everything's signed or vetoed, and we're really happy that all 4 of our bills got signed. Yeah, so that's the kind of stuff that we're fighting for. It wasn't like, it's not something like major dollars of child care, not that, but it's things within the system that help it, that incrementally kind of move things in the right direction. And so that's something that, we're really happy about, proud of. Another thing, I'm giving you a lot of information, just kind of going through many different things, but this is something kind of continuing on something I've talked with Beth Star about. I did a webinar with Beth Star a few months ago, kind of talking about this move. It's called a move from mandated reporting to community supporting. The idea is mandated reporter laws say, if you at all have a suspicion that there might be child abuse, maltreatment, you need to call the hotline, you call Child Protective Services. And we agree that should happen. Any child who's in danger, if there is abuse, or even if you're not sure, you think maybe there might be abuse, you should call it. What we don't want to do is have calls that don't need to be calls where it's just some support, some families, it's an issue. There's not neglect, there's not abuse, there's just a family that needs help. Maybe we call and get them some support instead. But in order to do that, there's a lot of laws that have to change, there's a lot of mindsets that have to change. We are part of this by trying to do that. The state actually put together what's called this mandated reporting community supporting task force to kind of figure out how to do this over the last couple of years. All for Kids was asked to be part of that. Our staff members, including myself, I served on this, were part of the subcommittees that worked on this because All for Kids has kind of a bench of working on prevention, kind of doing this kind of work. And so they asked us to be part of that. And there were a number of recommendations that came out of that. This was we released in September of last year. We released this kind of big report we in the task force did that asked for a lot of different things. And I'm not going to go through all this stuff. There's a lot of some stuff in different stages, but all the stuff here in green, we're happy that this year substantially got passed in the state budget. In particular, what this one thing is about training says that the state should do like a kind of a gold standard training for managed report. It has to, of course, include all the different things about what are the abuse or what signs you look for and stuff like that. But also when you're training people about how to call, let's also make sure they know kind of about, talk about implicit bias. Let's talk about the fact that there is racial disproportionality. That so many more families of color are in the system than there are in kids in the school. The trauma that's inflicted by entering the system, and yes, the system can help, but also there's trauma that is inflicted by even investigation can be traumatic, and also the awareness of community supports. One of the big things for All for Kids, like let's make sure that if you're a mandated reporter, you're even aware of that there are supports, aware of how to find those supports, how to get that. That should be part of your training as a mandated reporter. If you're there, if you're interacting with kids, if you might see a kid, yes, you should have your eyes open and call protective services, but also, at least know how to get help. And so a lot of the stuff got, so we were really happy about that as well. And the last thing I'll talk about, a couple bills of interest that were not in our policy yet, that I officially think we're doing, but we were watching very closely because they're important, have to do with immigration enforcement and children. The first couple are about at schools. So if immigration enforcement does come to the school, first of all, saying like you're not allowed on the grounds unless you have an actual warrant, to kind of make sure that you're actually, it's actually a legal thing that you're doing. Also, we can't, the schools can't give personal information about the families unless there's a court order. And also, if you are on the school ground, we're going to let our staff immediately know. We're going to let the parents know. School, we're going to let the students know if that's a college. Kind of like making sure everybody's, because there's so much fear out there, so much people are afraid to go to school, people are afraid to go to work if they're at schools. So that's kind of it's putting some safeguards on. And then the last one, 495, has to do with family safety plans in case the issue is what happens when the kid comes home from school and the parents aren't there because they're being detained, deported. Like, what do you do with that? And this sets up some safety plans so that the caregivers' wishes are met. One of the things is kind of called a temporary joint guardianship. So you don't have to give up full custody of the child just in case you might get deported. So you can assign a family member who can be a joint guardian that can, in case you're not there all of a sudden for immigration reasons, will then still have the ability to like talk with the school and say, here's what should happen and make kind of these decisions. And so these all got signed as well.
So on that last one, at what point is that put in place? Is that something that I have to forethink that because there's a possibility I may get deported because it's not going to work after I get deported?
Correct. That would be a thing that you'd set this thing up. Talk to lawyers, I'm sure there are groups out there that will help people. But yeah, it's set up with a joint guardianship. There's rules about who your family. One of the things that's kind of got changed a lot is it had been like you could appoint anybody, maybe your neighbor, the one who watches your kid. That kind of got amended out. There's a standard version of who could be family that could be included in that. But yeah, it would be a thing you have to set up ahead of time. But at least if you do that, your wishes are have more weight now than they would have.
So no, kind of like a crisis plan.
It's a crisis plan. Exactly what it is. And by the way, that was my last slide. So I love that you asked a question because I'm definitely open to any questions. I went through a lot of different things. I can go back some slides if you want to say anything, but yeah, that's the kind of stuff we're up to. And I always include our information if you want to reach out. If you have a question, advocacy@allforkids.org.
will that be available on the site, you know, for us to go back to look back to give people information?
Slide deck, I'm definitely, Best Start has it, and if they wanna get it to however, I'm good with that, I'll get you a PDF version of it. Logos all out there, but I do.
If you can make sure to sign in, so you have your email, we can blast it out to everybody.
See, she knows how to make sure you sign in.
I just wanted to add for anyone that wanted more information on the joint guardianship, Sheila was here during our Hispanic event, and they're actually doing workshops, and they have like, they're giving all that information, and if you want a workshop for them, they can come in and do a workshop on the joint guardianship and go over that with your families.
Do you have any of your flyers, with your, or cards with information? Because, some people will go directly through, flyers. And it's an easy way, to let somebody know on the spot. About guardianship and domestic violence, child abuse, and, a lot of people are silent. And then there's other people in certain situations where they make up those stories of abuse and neglect. So, having that information and knowing how to, when to contact a doctor or a mandated reporter or in any situation. A lot of it can include drug abuse or a lot of it can include a variety of things. But if we can get that information firsthand, we can also invite more people to come and learn about these, situations, these, issues.
So, there's a lot of different, pieces of information. So if you're talking about the joint guardianship, it sounds like someone who was here, earlier, Cynthia, who was here earlier that had the, training? Do you know what organization, that public council, or who, what organization it's from? Sure, okay, that's, sure. So thanks, was here, so there was an organization, somebody with an organization was here who had that information, so like, I don't know about the joint guardianships, like how to set one up, but that's kind of why we come together here, so you can kind of find the information. If you're looking for supports, like I'm talking about, that's a lot of like why they do these, roundtables here where they have different organizations come in. So certainly I think that START is a great place to, if you're trying to find a certain thing, ask them. If you want to know about like advocacy and how to get involved, what's going on in the state, bills and stuff. That's why I put up my email address. I don't have a flyer. I could give you my business card if you want. But yeah, it's there. Also, allforkids.org/advocacy has my information, has all this stuff I was talking about, and why that's up on the website. So yeah, I think I would say I'll give you my business card and then everything else, talk to somebody at Best Start, and they'll get you connected with the person, kind of the person that you're looking for. Does that answer your question?
Yeah, I have a curiosity. My curiosity is, for all the kids, do they also, advocate for changing the school's infrastructure and training for teachers? That we have so much new data that this old structure that we're operating on is not inclusive, nor is it, it promotes, that thriving that we're, being really advocating for kids.
So I will be honest, so you'll see from the very first thing, education stuff's not on here. So you're asking like, where's the education stuff? Honestly, that gets into, there are so many people on different sides of that. There are so many pieces of that gets into maybe quagmires of this thing, best way to call it. That's like such a specific other thing, and are you trying to support teacher unions? Are you trying to support charter schools? Are you trying to like get kids and best education no matter what happens to employees or like, or is that like that whole thing? We don't get in the middle of that. You also notice housing is not up here. Generally, we want to get parents the money they need they can get housing, right? We want to have strong communities, things like that, but I don't like housing itself is a big issue. Build, and it'll have to figure itself out, or kind of like it. So because of the intricacies and the way it kind of pulls us that off topic of stuff where we're like, we can clearly say all for kids, we do mental health. So we talk about mental health, right? Preschool, we have a state preschool at our place. So we talk about preschool. So we kind of like stick to those things that we specifically do, expertise on it, and say, we're experts on this. We've been doing this a long time. Here are things you should do. Strong communities we talk about, because like Best Start, it's kind of like this idea of this community. We do that down in Magnolia area. We do that in Network Anaheim. So it's like, that's where we kind of stick to those things. So there are some things missing, but that's why they're missing.
And just to add, Anthony, I do want to invite you to the policy committee, because although All for Kids isn't targeting, those education, Best Start, our policy committee could, fight for that, because that's something that the community wants. So if you want to speak to the local, our local officials, like that's something we can have our committee start planning on early childhood education, or on child education, on housing, which is something that our first 5LA, our funders, are now wanting to see us that start as a community get involved in housing and poverty alleviation. So, and I invite you.
Yeah, excellent. I'm so good at this. Anything you have a question, we'll watch you come to me. We have something for you. And one thing I'll say on that we do is we're kind of like the strong communities in education come together. There's a thing called community schools, where if there's any chance where we can like bring supports to a school, because that's where the kids are. That's the thing we do support. We are very big on community schools. So that's like, we're not getting in the middle of like, they have the curriculum, but like, hey, let's make sure we're on the campus, we're there, mental health is there on campus, that kind of stuff we do. That's where we then enter and say, okay, here's how to support this.
Yeah, I was tabbed on to that, because I know one of the greater frustrations with parents and even teachers, right, is this them coming together as an alliance, right, instead of opposing each other, working with each other, right? And so if we get the tools on how to advocate and how to communicate, to the teachers and letting them know, hey, we're not actually adversarial.
Yeah.
We're here for the purpose of the kids, right? You're a teacher teaching the kids, and we're the parents who have these kids. And how can we formulate this wraparound services, right, to engage and help our kids navigate through the system, right? The passport of education, right? From 0 to 5.
So again, there are kids from the policy committee. I know, and it is not just about.
So we just start this plan, and we know that now our local officials are really doing these meetings and town halls and wanting to hear the community input. So this is why it's important, and I would love to hear your guys' voices at our policy committee, because we're focusing on the AV, the region of Antelope Valley. Right. Yes, All for Kids is amazing. They're focusing on the whole LA County, the whole LA County. So I love what you guys are saying, and I love that it's like advocating for the Antelope Valley. So, if you guys would love to join the policy committee, so we can start getting that,
And one thing is influencing the policy committee, and like, okay, what should we focus on? But another thing is, even if like, the whole group says, well, let's not get into those education thing. There's the training of kind of knowing here's best practices for getting involved. You might already be involved, like just kind of one more, I know stuff they've done before is kind of like just talking through it. Here's the education, here's how to do it, here's how to speak up. And so maybe you kind of take those skills you learn in there, even if the policy committee doesn't focus on this one issue, you learn that now, you go be a better advocate.
This might have to do with the policy committee as well. I have the majority of the All for Kids programs with my daughter. She actually just graduated from Healthy Families of America. But I have noticed that throughout the community, because I've gone through a lot of community events, the lack of programs for 6 to 12 school age years is not there. And I see that we have a lot of mental health for that age range, but not to prevent it. So how do we get them? Because now they're going to be individuals going to school. It's how do we prevent them to get that mental health issues of stress, anxiety going into housework, homework, chores, also like navigating their whole life as well. If I'll be working with you, Steph, soon. Just to voice it out, it's like, how do we get that community engagement so they can learn how to navigate through life, not multitasking, pretty much, you know, because that's something that we used to take care of.
Yeah.
So it's how do we do that for them?
Yeah, and I think it's really important that you bring that up and that you kind of keep finding that. And I don't know so much about like that age gap is a problem because like, you know, when the 0 to 5, maybe the 0 to 3, like that is really important and that kind of sets the foundation. And I think we all agree with that. But then when you say that, and then okay, we have the youth, but then like what you're right, there's that gap in between there, and so I don't know how to address that. I will say on the prevention side of things, we agree prevention is so important, and that getting involved and talking about it is really important. This is something that actually happened last year. So on the March 2024 ballot, there were some changes. It was called Proposition 1. There were some changes to what was called the Mental Health Services Act, where there's a millionaire's tax that funds a whole lot of the mental health that happens in throughout California. So a lot of what the Department of Mental Health's budget comes from this money. And there were a lot of changes made in many ways to try and address homelessness, to try and say, look, like homelessness is a mental health issue. So we should take some of this money and put it towards homelessness. And now, that's a good thing. The problem was what was before, there was like this dedicated amount that of the MHSA money that was going to kids. And it was specifically said, especially in prevention, there was a certain amount of prevention that had to go to kids. And there was a certain amount of services that had to go to kids. When the legislature was looking at like what to put on the ballot, the governor's version did not have that anymore. So all of a sudden, all these protections to say, hey, we need to make sure we have the stuff for kids and make sure we have the prevention wasn't there anymore. And so All for Kids was part of a group that kind of said, hey, wait, that's not okay. Like before this gets on the ballot, let's change this. Let's have this, we need to make sure we have these safeguards. There was a lot of people who came together like that for exactly that reason. To say before, like, yes, homelessness is important, we gotta deal with it. But how about, we start with preventing the mental health issues when they're kids before you even get to that point. Like, let's not take money away. And like all of a sudden now you have to deal with more and more people 5-10 years from now because they didn't get the prevention that we used to have. So we fought for that. We were able to get that back in there. And so now again, there are these kind of like guaranteed percentages of these that will go to prevention and will go specifically of that prevention will go to prevention for kids. And so it can be taken away. And if we don't speak up, you got to make sure it stays. So I think that's a great topic. Other questions or points? If you want to say something, you think about stuff. Whoa, doesn't can't stop that anymore. That's depressing.
This is because on the time I know you have to go.
I don't actually.
But I always do this in every meeting that I'm in, as far as bring up this topic of arrested development, as far as a mental health.
Oh, my favorite shows.
Yes. That's something again that I always highlight and tell the public that we don't talk about enough. A lot of the issues with behaviors that we're seeing in kids that's very problematic as far as a nuisance. I mean, really like on the safety side is directly connected to trauma issues that's disrupted their development, which we call arrested development. But again, we don't talk about it. We know about it, but we don't talk about it. I'm just putting it on your mind. That is something that definitely have to be at some point highlighted on the top. To know that human beings through trauma is where the disability is. Just like just being, just born with a disability. Sometimes, something else going on. But trauma is also causing disabilities.
Yeah.
And we're not talking about it. I just want to put that on your mind.
No, I know. And that's one of the big things that, kind of a lot of people who have things in schools and it gets set up as like, oh, well, they must have ADHD, they must have this or that. And like, well, no, maybe it's because somebody, their next door neighbor got, shot. They had to walk by it. Maybe that's what caused the problem. And you're right, exactly, the arrested development. Are there things that putting on people's minds, are there things in particular that you think, should be changed? Or like, is there something that would help that's not happening right now? That like, what would be the thing that would help like, if people knew more about it, then this would be happening more? What are certain things that I should kind of think about to bring back?
The research.
I mean, cause there's research out there in the conversation.
Yeah.
I mean, like you said, like, let this be part of the meat of the conversation, dialogue coming from 0 to 5. If the parents are traumatized, then the kids are gonna be traumatized, right? You pass it on, it's environmental stresses, right? Certain people, places, and things, right, and choices, so, yeah, it kind of goes hand with that. I mean, the mental health, substance abuse, use disorder, and all those things, so, you know, the homelessness.
Yeah.
So.
Okay, good, thank you.
Yes, because we focus on preventative things, which is good, but there's already things that have happened. So we need to also focus on right and wrong. Yeah, the interventions and fixing what's already happened to people. Because if my parents are traumatized, they probably have passed that trauma on to me, even in vitro.
Yeah.
You know, and so that's gonna keep happening. We seem to put Band-Aids on stuff as a country instead of really talking about the root issue.
Well, thank you very much for bringing that to my attention. It's great.
And that's not on you, that's just.
Yeah, that's just a conversation.
I didn't, no, I didn't take it that way. This is a conversation. I come and tell you stuff, and you help me tell me stuff too. I'm gonna go off and like do this work for all for kids, and if I don't have input, like this is really, that's why I like being up here to get this, so thank you. Yeah, go ahead, sorry. Go ahead.
Hate speaking in front of people, but I just want to give a little bit of ease to some of the questions that are being asked in regards to trauma. I'm a home visitation, so I work with the parents 0 to 5 to prevent. We're in the homes weekly to prevent some of these things. And some of the things that we do address is the trauma. So when we do that intake, I'm gathering a lot of information in regards from the father and the mother, and it goes back to the mother's childhood. All that is into our curriculum, so it's an ongoing conversation to help prevent that focus child from some of the childhood things that maybe mom and dad prevent some of that. But once again, once 5 years old comes, we're out the picture. So, but hopefully we have given enough curriculum and handouts and support and emotional support and resources that can stop it from going. So I just wanted to let you guys know that some of those things are addressed in the home education program. And it's a lot of prenatal information is given to the mom to help her, depression, and so it's an ongoing thing.
And thank you for doing that.
Yeah.
I don't even think extended resources, once they're out of the program, then they're on their own.
No, I agree. And so it's not focused on the 6 to 12-year-olds, but just generally, that's why we're always about the community supports. It's like, well, let's let people know about it. Let's get more of the community supports out there. So yeah, that's exactly right. This was great. No, go for it.
We have one more question because we do have to continue on.
I don't have to leave, but they have.
Oh, go ahead.
So Best Start, here in the AV, you know, we're seeing, some people are going to, picking up religious counsel, you know, and then they also come here for support as well. To help, teach, how to end trauma. Yeah, and we have to continue to, hit it at home, focus on these things. We have to set up we have to set up that education for those people who are experiencing trauma, because we're seeing it all outside of yeah. You know, I think that we're falling behind, and then we start to see these individuals deteriorating, so we need to catch them up to speed, you know, slowly but surely, and we see the lack of communication. Maybe it could be based on skin color or their environment, whatever it may be. But we have to continuously build that bridge and, connect with these individuals and share with each other from these experiences that we bring up, that we bring to the table.
Couldn't agree with you more. It's a continuing fight, and you need to keep always pushing it, so thank you for that.
And just as we continue on, just a brief reminder, Best Start offered, and we have some trainers in the room for trauma informed. We also have some trainers in the room for nonviolent, trauma informed nonviolent parenting. We also have some trainers in the room. This is why we train the community, the growing brain. They're in the room. You are in the room. We need to implement what we have been trained to do throughout our community. Thank you so much, Adam. Thank you for all the information. Now we're just going to have a brief because our time is running. We have some updates from our Best Start committee. And the next one coming up is our Welcome Committee. Come on, Ms. Gloria.
Thank you, and I will be very briefly, just to let you guys know from, I guess, like everyone says, from our last meeting, we did mail out some re-invitation postcards to all our members. I just want to highlight, we do meet once every Thursday of every month, and we usually do it in person, but this month, unfortunately, I got a little bit sick, but we will have a virtual meeting today. If you're interested, please see me, because I will send you the Zoom link. We will be getting ready and to discuss further events, and the welcome committee is actually to engage more community, to have participation, and to strengthening our community by doing so, inviting all you to the table, so that we can go ahead and move forward and see what the community wants. So just very briefly, I have a lot more, but since time, I want to really invite you guys to see me, and hopefully I can engage you guys all in the welcome committee.
Hi, everyone, me again. We want to invite you guys to the Sustainability Committee. So as you guys know, this has been an ongoing committee that started last year around June. What is the Sustainability Committee? So the Sustainability Committee, there's a plan developed internally with All for Kids that really is how to sustain Best Start's efforts. How do we continue this capacity building? How do we continue the collaboration? So All for Kids does have a plan, but we need the voices of the partnership, which is all of you guys. So we invite you guys to attend the next Sustainability Committee, which is October 23rd, and it'll be from 10 a.m. to 11:30 virtual. Oh, there's two, sorry. There's two meetings this month. So October 23rd, 10 a.m. to 11:30, and then October 28th, 12 p.m. to 1:30 p.m. You just scan the QR code. It's gonna have a little tab that I believe, again, you scroll down, it's gonna say join the committee. You just select sustainability. It asks you for your name, email, so then we can now contact you and send you reminders and updates for this committee. Carla is the one running this committee, so if you guys have any more questions, feel free to reach out to her or reach out to me or reach out to the Best Start email. And then if you just want to see the slide. Excuse me? I'm sorry, who's their web page? Is it just send to reach out? Yes, if you're interested in signing up, to scan the QR code, it leads to our Linktree page. So the Linktree page has all of our signups for anything for our next partnership meeting, our committees, and then it has more information on All for Kids. So just like the advocacy, you guys want to see more of Adam's the bills that passed and more information, like you will be able to find that all in that Linktree. And then we're starting up a Best Start Parent Advisory Board. And why is this? Really want the parents with children 0 to 5 to now be the drivers of Best Start. Really tell us what we need to be doing within Best Start and the partnership. So again, if you're a parent of a child 0 to 5 and would love to do this leadership role to really guide the Best Start work, if you just scan the QR code, there will be, again, an application. So the application, is due on October 30th. So we do have a week and a half, away from October 30th. It shouldn't be long. It's just very detailed, just to let you guys know what the advisory board, what the expectations are. And then following up with a phone interview that will be conducted after November 4th. So if you're selected, then we'll conduct a phone interview. Again, this is all voluntary. If you're a child 0 to 5, we really want to invite you to apply for this advisory board to really give us the input of a parent 0 to 5, for the Best Start Works in all our efforts. And then I will pass it on to the rep.
Awesome. So you have an opportunity to get involved in some of these committees. We need your input. We need your presence. We need you at the seat. We need your voice. Y'all got real quiet right there. Yep. If nothing else, that was an amen moment right there. Keep going. So our learning opportunities that are upcoming, we have our parent advocacy workshops. You can scan the QR code. Stephanie told you a little bit about that. It's advocate for early childhood education in the areas of advocacy, one-on-one, diversity, equity, and inclusion, our anti-bias, anti-racist practices, and special needs support and multilingual education. If you're interested, scan the QR code. I like these QR codes. I don't know. I've gotten educated doing this stuff with Stephanie and Carla. You know, technology was not my friend at first, but because I used to sit in front of David, it became my friend. And so I learned QR, AI is something else. Anyway, scan the QR code and you can get involved with that. That's some friends. And then we also have some flyers over here on the side in front of Lizette. Also, our UPK parent info sessions. Come and join. Come and join us. It will be here at our All for Kids site. Join us for informative sessions on your parental choices when it comes to your child's early childhood education. These are available. Scan the QR code. If you don't have any children 0 to 5, thank goodness. But I have grandchildren 0 to 5. If you have nieces, nephews, you just want to get that information out to family members that have children 0 to 5. Scan that QR code and pass it on. This is our next upcoming Nurturing Relationships series. And we're so excited about this. This is our presenter is Katia Enrique Sanchez. She is a parent that she comes to our meeting. She's not here today, but she has since become a trainer. So her sessions will be, each session celebrates connection, play, the presence, transforming everyday moments into powerful, nurturing experiences that strengthen relationships and support the whole child. This is why it's important for you to get involved. You are the community. This work is led by you. So let us know what you are going to be doing, what you would love to see come into our Antelope Valley, what our families, you believe our families 0 to 5 would benefit from. And this is one of them. All right. So here we come. We're coming to the end. Our community announcement. We have coming up, and in fact, this is tomorrow here. We have an opening for 15 families. Let us know if you're interested in this for our Black Infant Health Community Harvest Fest. So Best Start families we have a slot of 15 that can be a part of this Harvest Fest. And it's going to be just a lot of fun. We're going to have community vendors, resources, trick or treat, candies, everything you want your kids to have to keep you up all night long. They're going to be just going on sugar highs. But anyway, we have food, we have games, face painting. It's going to be a lot of fun. If you're interested, see Gloria or myself and let us know if you're interested in that. Also, the Sensory Spooktacular Trick or Treat Trail. This is also taking place October the 24th from 4 to 7. The QR code is up there if you're interested in that. We also have coming up Coming soon, Ohana Center is having their grand opening. We are invited. They are a part of our partnership. They are part of our stakeholders. We posted several events with their trainings there. So we want to go and celebrate with them their grand opening ribbon cutting. That will be next Saturday, the 25th, from 11 a.m. to 2 p.m. All for Kids is hosting the Autumn Festival Trunk or Treat the 27th October from 3 to 6. It will be here at All for Kids. You are welcome. The QR code is there and you can get more information. We're intending to have a lot of fun, activities for the kids, and just a lot of giveaways. And you'll get a chance to see some of the other programs that are under the All for Kids resource center. All right, and we do have this flyer as well over here, inviting youth in foster care to join our focus group. If you are aware of any youth that are in foster care or have foster children, this is available through our All for Kids, Together California, Best Start. Together California is inviting foster youth and former foster youth ages 18 to 25 years old to participate in an engaged focus group. So while this doesn't focus on 0 to 5, you might have family members or be a foster parent or know foster children that would fall in line with this. We want to invite them out to participate in this particular activity. It is a focus group. We need to hear from them. We need information. So we also have flyers on the side where that is. Again, how many have participated in our All for Kids food distributions? You've come by and gotten food. I know we had it yesterday. It's awesome. We have fresh produce and fruit given, and they're huge. You ever see those carrots? I'm like, what did Bugs Bunny put in the soil for their carrots? They are huge. So we do this monthly. We just had it yesterday. We will have another one in November on the 19th and December the 17th. Flyers are available. Please let the community know this is something that our community needs to take advantage of. We're here. We offer the produce. It's free. So just share that information with your neighbors and family. All right. I want to invite you. We're coming to the conclusion of this. Follow us. Follow us on our Instagram. You can scan our QR code. This is where you get all of the information of what we're doing, how to get signed up for any of our programs, how to join a group. Our link tree is here. Come and let your constituents know, your community members know, your neighbors, friends, family. We want the community to be more actively involved and really know what resources are here and how they can be an important part of moving some changes, causing changes to happen in our Antelope Valley. So with that, I love this guy's face. Look at his face. Look at her. She's so cute. She's so cute. How do we do? How we doing? She's giving us a look like, yeah, I'm kind of, no. Scanners, please do that right now. Let us know. Take a quick survey. This is how we know what we need to do as your Best Start team. How do we improve what we're doing? What do we need to change? Are we doing okay? Are we getting the information out? Let us know. Scan that QR code. Fill out that brief survey. Take a moment to do that before you leave. And guess what? You know that saying, if you feed them, they will follow. We got lunch for you. Yeah, you better be excited about that. Yeah. So with that, we are concluded. We have concluded our meeting. We have lunch available for you. Please get something to eat. And thank you again for giving us your time, spending your time with us. We know you had a lot of things you could be doing, but we really appreciate you coming for this meeting. Have a great rest of your day. By the way, Miss Gloria is here. I'm here. David is here. If you are interested in being a part of one of our program project committees, I am with the curriculum building the business part of it. What we have to do, Miss Gloria is here for the welcome committee. David, the data committee. Stephanie is with the sustainability and policy. Join the committee. We want to hear from you. And we